Welcome to The Healthline, issues that shape our well-being. I'm your host, Dr. Andrea Ault-Brutus. In The Healthline, we provide engaging and informative content on the factors that shape our health and well-being, along with innovative insights that help us gain a better understanding of our ever-evolving complex healthcare system. Today, I'm very excited to have Dr. Grace Catala on The Healthline. Dr. Catala is an assistant professor in the Department of Allied Health and Kinesiology at Hofstra University's School of Health Sciences and is a full-time faculty member in the MS in Athletic Training program. Her teaching areas of expertise include therapeutic interventions, injury prevention, pharmacology, and nutritional interventions for athletic trainers at the graduate school level. She also teaches first aid and safety for the health and safety program at the undergraduate level. Dr. Catala's research interests include cultural competency in allied health education and curriculum implementation. Dr. Catala, welcome to The Healthline.
Thank you so much for having me.
Well, we're excited to have you here. So can you tell us more about yourself and what sparked your interest in athletic training?
I remembered that I wanted to be in the field of sports medicine since I was young. I was always athletic, played sports growing up. I also had an interest in math and science. And so whenever I'd watch basketball games or soccer games, there's always the person that gets hurt, and then someone would run out into the field and they would take care of them. And I'm like, wait, what is that? And so I realized that was sports medicine. And obviously that's a big umbrella of many professions. When I started to kind of put it together and realize athletic training is kind of where I wanted to be, that's always been my goal since high school. So I was an assistant gym teacher. I'd work in a nurse's office, volunteer, and I really liked helping people. So that was always been an innate attribute of mine, and just wanted to be around sports as well too. Kind of wanted to be behind the scenes and be able to help people. And so I journeyed through that, and then I followed Big East sports. So I ended up going to UConn, University of Connecticut, go Huskies. And I got my undergrad in athletic training and my minor in nutritional sciences. I was able to graduate. And as soon as I graduated, I attended the 2008 Beijing Olympics, actually, provided nutritional and sports medicine care to West African country, Equatorial Guinea, which is also where my family's from. So that was with great pride. And just being able to see how sports medicine was interpreted, working with other physiotherapists around the world was really exciting to me. So I knew this is the path that I wanted. I've worked in several settings, outpatient physical therapy settings. I've worked at high schools, colleges, semi-pro with FDNY Bravest football. Worked with many different patients and demographics, from young 8-year-old gymnasts to 80-year-old marathon runners. And that's always been a great challenge for me, to still apply athletic training no matter if you're an athlete or not. So athletic training has definitely grown to allow me to continue my passion today.
Great, amazing. What is an athletic trainer? I'm sure many of us could imagine what that is. How do you define what athletic training is and what is an athletic trainer? Tell us more about the program here at Hofstra.
A lot of times when you hear athletic trainer, most people get it confused with personal trainer. So they think it's just someone that helps, get somebody stronger and better, or lose weight or work at a gym. But athletic training, yes, its origin started with athletic teams, but we've come to become holistic healthcare professionals that are able to recognize emergency situations, provide health promotion and prevention skills to active people. So instead of saying athletes, we say active patients, as well as rehabilitate injuries or athletic injuries or active injuries, post-surgical, non-surgical, provide emergency care, as well as therapeutic interventions to allow the person to feel empowered to overcome any injury that sustains them. Now it's transitioned to a master's program. So when I went to school at UConn, it was a 4-year program. You went through the whole curriculum, and then you sat to take your boards. So board certified athletic trainer once you take your certification, which is nationally recognized. And then you would get a state licensure to make sure that your profession is protected as an athletic trainer and you have the ATC credentials. So it's a very intense, rigorous curriculum, but it's full of great experiences, because not only do you take your didactic work in these domains, like I mentioned before, but you're also doing clinical rotations. So kind of similar to your other allied health professions like OT and PT. And so you get to work in different athletic settings, different populations, to really understand how to apply those skills of athletic training. Athletic trainers are everywhere. You may not know it, but they're definitely in a lot of different places besides schools and professional. It's really a great field as more of our baby boomers, right, are becoming more active and generations are living longer. Definitely need more allied health professionals, including athletic trainers, to be out there. So I'm very proud to be a part of the profession and representing it so people understand what it is.
Great. And actually, March is National Athletic Training Month. Can you tell us more about why celebrating this month is important?
So March is marked as National Athletic Trainers Month to kind of showcase and honor and promote the profession. We are champions of all, which is kind of the tagline for this year. And kind of saying that just means that we're able to be someone's champion, right? As I said before, I've been lucky enough to work in different settings. Kind of being that person to make them feel better after an injury says a lot, right? So when we approach care, it's not only physically, but it's also mentally, spiritually, right? Sometimes it's just a laugh. So we become their champions and we push them to be champions to overcome any obstacle that they may have. So March is really exciting time for us. We do a lot of things locally, nationally to promote the profession so people kind of understand who we are. Here at Hofstra, our students partake in different events. They're doing the film competition actually here for National Public Health Week. And we're also doing 2 CPR, AED, or Narcan training sessions. When we first started it with National Public Health Week, we started with 1, and we had such a growing demand that we've expanded it to 2. So we kind of bookend the week we started with, and then we end with another session, which is great. And being taught by athletic trainers kind of showcases our emergency response and how well-versed we are in emergency medicine. And so we also hit to social media and, showcase who we are. We do like a day in the life of an athletic trainer or a day in the life of a student athletic trainer so they can see how much fun but hardworking that they are and just another level of appreciation to celebrate what we do every day.
Nice. I want to talk more about the alumni from the program. And I understand based on our previous conversation that there's 2 paths that people could take. One in a more traditional athletic training setting and one in a more non-traditional, I believe it was industrial setting.
It's categorized as traditional settings and emergent settings. Yes. Okay. So traditionally, or you could even say historically, athletic trainers were working at the high schools, colleges, professional levels, so mainly with athletes or athletic populations. As the climate of healthcare has changed and the need of more healthcare professionals had changed, the skills that we have relate well in other settings. So those are our emergent settings. This is performing arts. This is industrial, like you mentioned before, so working with a construction site or a vocational company. Amazon actually hires athletic trainers, by the way, as logistics specialists, which is just to show you the emergency and how athletic trainers are being appreciated in these different fields. We're also present in urgent cares, emergency rooms, and physician extenders, just to name a few. So it's really been cool to have athletic trainers in those settings, as well as a lot of our alumni that have graduated from Hofstra. Hofstra has had this program for over 25 years. Some alumni to mention that are in different settings. Ezra Bison was the assistant athletic trainer for the Jets after he graduated here from Hofstra. Just as recently has now started working with the Houston Texans. And he's one of our recent grads and was able to open up internships with our students over the years when he was with the Jets and most recently with the Houston Texans. So that was his way of kind of giving back to the program, allowing our students to kind of see what he does, which is really great. We also have Chris Napoli. He's a man who wears many hats. He's also one of my colleagues, and I co-instruct some of the courses with him in our Masters of Athletic Training program. But he's also the head athletic trainer for Copiague High School in Suffolk County. He's also our adjunct faculty, like I mentioned, and he's also our president-elect of our New York State Athletic Trainers Association. So he does many other things as well, too, to give back to the profession. He learned that passion from coming here to school at Hofstra, which is really great to see. An alumni that I actually had as a student, Bryce Tomley. He's the athletic training supervisor for Orland and Cohen Orthopedic Group, and he's also contracted out and works with the New York Junior Islander hockey team. So with our New York Islanders, they have their junior league, and they didn't have an athletic trainer prior, and Bryce Tomley is well-versed in hockey as a former athlete himself, and he started that program, and that has promoted him and just the last 3 to 4 years that he's graduated. So he's doing us proud. We also have a recent grad from our master's program, Amber DeMoro, who is a women's basketball athletic trainer here at Hofstra. She just graduated last year and got the job as soon as she passed her BOC. So we're truly proud of her, among many others. Other settings that you wouldn't think of for athletic training is entrepreneurship and business, right? So we have Craig Lenegro, who's also Hofstra alumni from a few years ago, and he developed a food bag, which is pretty innovative. So with working on the sidelines, right, athletic trainers are out there, sunny, rain, snow, sleet, kind of like the postman, right? We have our equipment. How do we keep our equipment dry? So he invented a durable waterproof bag system for this, and he's been able to sell. He's been pretty successful at that and representing athletic trainers as innovative business owners as well, too.
Great. Well, let's talk more about the work you do. So can you tell us more about your research area here at Hofstra?
From my doctoral program, I was always interested in how do we truly assess and apply and implement into a curriculum, not only for athletic training, but for allied health, the ideas and theories of cultural competency and cultural humility. As our patient population continues to diversify in age, ethnicity, race group, and just different backgrounds, our healthcare professionals, right, need to benefit from continued encounters with patients from those groups and continue to kind of be able to meet the patient where they're at and kind of provide patient-centered care. So a lot of the literature speaks on the theories of this and certain teaching methods on it, but I was really more interested to see what exactly works, right? And it's not going to be one method. There's going to be a combination of stuff. And does that prove in, quantitatively, right, to work? So a lot of the research that I'm doing currently within our program is assessing a multimodal intervention to see if there is progression of cultural competency and cultural humility within the student cohorts that we have. So we've done several sessions to promote cultural knowledge, cultural awareness, cultural skills as well too, through simulations, watching videos, case studies, and discussion, as well as reflective questions. So understanding the quality of their knowledge as well too is super important for us to know that as instructors, we're able to address their concerns or any deficits that they want to learn and improve upon. We've also created assessments for the preceptors. So a lot of our students, when they go into their clinical rotations, they have to get evaluated from their preceptors. So we added a component into that. So we have more of an objective measure to see that they're growing. So I definitely want to preface this by saying being culturally competent is not a one and done. It's a progression. It's a lifelong progression. And as faculty, we want to see that growth in our students, right? No matter what the field is. So this is a great barometer for us to see that when they first come in, their first clinical rotation, okay, they're at a certain level. It's not saying that they're not trying, but how can we improve that to give them a more holistic approach? And by the end of the 2.5 years they're with us, to see them grow into an advocate for athletic training, for diverse populations, and to continue to provide that not only from the experiences and encounters they get here at Hofstra, but moving forward to any of the traditional or emergent settings that they go into.
Great. So can you expand on why it's important to look at cultural competency in athletic training?
Yes. So the literature shows that it's important to address that because in more traditional settings, as I mentioned before, athletic trainers work with athletes and patients from different backgrounds, populations, and ethnicities. So a lot of our athletes in pro sports, right, are non-Caucasian, but the population of athletic trainers tend to be male Caucasian. So it's not saying that they're not able to. They definitely do, and they definitely want to. But what are some proven methods that we could implement from the educational component that allows our students to then graduate with a better understanding, or at least a wanting to continue that humility to work with diverse groups? So we have to create more encounters with their clinical settings, diversify their clinical rotations. So the literature does say that. And so preceptors alike, faculty, and students are working together to try to find that. And so also, according to our professional standards by CATIE, which is our accreditation board, there are actually 2 standards that are devoted to promoting cultural competency, humility, inclusion, not only for ourselves in the curriculum, but also how do we assess that as faculty, that our students are getting the proper encounters, which is why it led for me to kind of do more research on it, just to find more assessment tools, to find a more objective measure, but also putting together the qualitative experience to make sure it's not overwhelming, but is organically woven into their curriculum. So it's important that our students graduate being comfortable with being uncomfortable, but also being comfortable to tackle anything that comes across them, whether it's a complicated health condition, complicated surgery, or a person with different cultural beliefs, and meeting them where they're at.
Great. And I understand that you've created a new course here at Hofstra.
So this is an undergraduate course offering. It's called Cultural Competency for the Healthcare Professional. Okay. So this is open to any allied health student within our School of Health Sciences. So it's running this semester as a half-semester course, and it's just going to tackle the main components of cultural competency, awareness, skill, knowledge, encounters, desire, and humility from a broader spectrum as a healthcare professional. I'm hoping to offer it as a full semester offering in the fall to really be able to dive in. And right now it's just being able to approach it from a more introductory standpoint, discuss the foundations of cultural competency and humility, a lot of simulations, short videos, discussions, reflections, and ultimately the goal is for the students to have a level of awareness, a level of knowledge of different diverse populations and patients, and how that applies to their desired field of work, and how they could continue that ongoing learning within their programs as they get more into their professional courses here at Hofstra.
Nice. Is this open to any student?
Right now, it's just any student within the School of Health Sciences.
Okay.
So
undergraduate and graduate, or
undergraduate?
Undergraduate only. Okay.
Yes.
Great. Just going back to the master's program, can you tell us how can a student learn more about the master's program?
So just a quick intro about our program. So it was first our bachelor's program, then we switched over to a master's program successfully 2 years ago. It is a 53-credit course curriculum. You start in summer 1, but it's pretty cool because you start in an EMT class. Oh. So summer 1, summer 2, we work with our Northwell EMT educational program here at Hofstra. They take the course, and at the end of it, they're eligible to sit for this New York State EMTB certification. So you get an EMT certification before you even start your first athletic training class. Yeah. So our idea behind that was to expose them to emergency care, critical care, which is one of our domains. And so when they go into the fall, then they go into their evaluation diagnosis classes, their emergency care class, health promotion class, kind of sets them up for that. So each semester builds upon another. So we lay a foundation on emergency care. Then we lean into interventions, which is the class that I teach, learning about modalities, learning about rehab, and the clinical rotations also reflect that as they do that with their preceptor. So anybody that's interested in it, we do offer a pre-athletic training minor for the undergrad, since we don't have the undergrad program anymore. But anybody that's interested in it, most people that are enrolled in health sciences, exercise physiology, they're already covering more than half of the credits to be able to claim as a minor for pre-athletic training minor. They could contact me. They could contact Dr. Jane Ellinger, as well as Professor Kristen Allegro, our clinical coordinator and program director. We teach the first aid and safety classes, so most likely those students have had us at some capacity, and anyone that's interested could contact us. You could also find information on the website. If you go through Hofstra University and kind of search athletic training, has all the information in there as well. So if there's any undergraduate students that are interested, you could still interact with us. We'll invite you to certain events that we hold so you could kind of see. You could also have opportunities to do observation hours, which will strengthen your application. So if you're interested in applying as a master's, then we kind of know who you are, but you're also getting a sense of what it is. And then you're able to catch up on curriculum credits as well, too.
Sounds amazing. And your passion for this really shines through. So thank you so much for being a guest on our podcast today. Any parting words before we wrap up?
Thank you so much for having me on the podcast to be able to showcase athletic training, our profession, promoting National Athletic Trainers Month, what our program has done here, our alumni, and some of the new exciting things that we're doing within research and curriculum. If you need to reach out to us and you're interested in athletic training here at Hofstra or just any information, please feel free to reach out to me, grace.a.catala@hofstra.edu. You can look me up on the Hofstra website as well, too.
Amazing. Thank you so much, Dr. Catala, for being on our podcast today. And thank you all for listening to The Health Line. We appreciate you tuning in. So thank you. Bye-bye.